Hello, my name is Amanda and I'm the Client Relationship Manager here at Empower Physical Therapy. Wanted to ask the professional, the expert, a hot topic we hear a lot about at the clinic and on the phones is about medication and injections. So Stephanie, just kind of want to hear your input. What do you tell your patients that, either are interested in trying injections or medications to help with their pain, or kind of what's your approach and your thoughts on that?
Yeah, I go through these conversations all the time with my clients because they don't really understand like how pain happens. So I tell people there's 3 ways that we feel pain. And the first way is like thermal, which is like burns, sunburns. Let's take those off the plate. The next way we feel pain is chemical. And that would be like you have an injury, you have inflammation that comes in. That's the chemicals that are coming in, and chemicals can treat chemicals. And typically how we know if it's chemical, there's certain presentations with it. And usually with chemicals, you're going to get that constant achy, throbbing type of pain. It's just there all the time. You can't really change your position and make it better and worse. It's always there. So that's chemical pain. And chemicals, which are drugs, injections, medications, those kind of things, can treat chemicals. But if you have mechanical pain, that is the mechanics. It's how our body moves. It's how our joints move. That's how our musculoskeletal system kind of works together. If there's an issue with that piece of it that's creating pain, then it doesn't matter. It doesn't matter if you throw chemicals at it. You're not treating, you're just treating a symptom. You're not really getting down to the root cause. My favorite analogy is like if you go in and you pull your finger back like this, if it doesn't matter what you do, you can do all the injections that you want, you can do the medications, but the whole reason why the joint doesn't like this and you're hurting is because your finger's in a bad position. Well, we do things throughout the day that creates problems. And if we don't address what those are, it doesn't matter what we do. We've got to address why the pain is happening to begin with. And so that's why a lot of times when people take medications and injections, they don't work, or it works for a little bit and it comes back.
Makes sense. So is there ever a point where you're working with a patient where you would actually recommend that they try medications or injections for their pain and their symptoms?
Well, there's questions that I typically will give my patients to really help them determine if they're at a doctor's office, if they should get medications or injections. And so the questions that I like to ask is, because we know the pain is constant when you have, a chemical type of pain. When it's mechanical, it can be constant, but it also can come and go. But with mechanical pain, if you change your position and you can make it better or worse, that's mechanics. That's not chemical. If your pain kind of comes and goes or varies, it gets better and it gets worse, that's mechanical. So if you kind of know that that's what it is, like you can ask your question, those questions to yourself, pretty much be like, no, medications aren't going to help. They're not going to do anything for me. That's why they don't work. So, the times when we will go and send someone to get injections, which is really rare, it's when they have that constant pain and we're trying just the bare minimum of things just to try to calm things down and we can't. That's when we'll go and say, you know what, go do this so that we can help you get over the hump, start getting you moving in the right direction so that we can kind of reduce some of that irritation. Because you can have both. You can have chemical and mechanical. But that's the only times that we recommend going to get medications or injections. And it's rare that we have to go that direction, but we do.
All right. Well, I think that pretty much covers the 2 main points that we hear. So I appreciate all the information. I'm sure a lot of people will get a lot of benefit from hearing the difference between mechanical and chemical pain. So thank you.
Thank you.